This podcast was produced by OAR FM Dunedin with support from New Zealand On Air.
Welcome to Disabled Persons Assembly's Notable Radio Show. DPA is a systemic advocacy organisation run by and for disabled people. DPA is a pan-impaired organisation with members across the country. Over the next half hour, we'll discover how we can work collaboratively to achieve inclusion for all New Zealanders. DPA's Notable Radio Show, a whole new attitude.
Kia ora. I'm your host, Amy Taylor, and this is DPA's Notable Radio. As the weather cools down and we wind down into winter, many of our community are feeling the impact of rising costs and uncertain things happening in our global community. I think that the war in the Middle East is something that is very much on the minds of a lot of people, and sadly, not only how it affects the people in that area directly, but how it affects every single one of us. Increases in prices of fuel and transport challenges are creating real barriers for disabled people who are trying to access work, services, and community life. But on the positive side, it's been a really busy time here in Otipoti, and the point of today's episode is to talk about the work that we've been doing, mainly over April, but over the first few months of this year, and to give you a roundup of recent events, advocacy, and community kōrero from across Dunedin and DPA's work as a whole. But before that, I do that. I think that on the show, one of the things that I quite like to do is to share some personal anecdotes about the impact of lived experience as a disabled person and some of the things that I experience personally and some of the people that are willing to share their stories experience. So what I want to tell you about is the recent costs that I've incurred during a cost of living crisis as a disabled person. And so let's start with yesterday, for instance. There is, as some of you may not know, there is a complete lack of publicly funded specialist health care for many of the chronic conditions that primarily affect women. These things include ME/CFS, POTS syndrome, which is what I have, EDS, fibromyalgia. So a lot of these conditions are relatively common. They affect women primarily. Something like 80% of people that are affected by these diseases are women. And there is very, very limited specialist health care available in our public sector. So the offshot of this is that we, as disabled women with chronic conditions, end up having to pay basically through our noses to access some of the minimum care. So I had a follow-up, and I'm telling you it was a follow-up because follow-up appointments are significantly cheaper. A follow-up appointment yesterday, a phone call, 15-minute phone call with one of the POTS specialists who is in Auckland. And this is not a discredit to this person. They're phenomenal, and they are filling a gap that the public health system does not fill. But this cost me $276 for a 15-minute phone call. And I'm telling you this was a follow-up because the initial appointment cost me, 15-minute phone call, cost me $560. This is just actually to the point of ludicrousy. Like, disabled people and those with chronic illnesses are minimised and excluded from workforces because of our diseases. I do not choose to have this particular disease that has no pathway in the public health system. This was not something I opted in for. And to add insult to injury, this morning when I went to go and collect the script that I had been prescribed during this appointment, instead of the usual $5 prescription charge, they charged me $15 because it came from a private specialist. It wasn't that this drug was anything. It was clonidine, which is a very commonly prescribed medication for ADHD, and it is Pharmac subsidised. But for some reason, I ended up paying 3 times the prescription charge. So I think that might give you some of an insight into the extra costs that being a disabled person actually bring to the table. The other thing that's cost me a huge amount of money over the last few weeks is that my wheelchair broke. And not only would the company that supplied it for me in the first place not pay up for the repair, which they should have done under the Consumer Guarantees Act, they dawdled so long on this that was 3 weeks of using a rental chair at $130 a week. Now, DPA is a not-for-profit. They're a living wage employer, and I am really privileged to be able to work at all and work for a living wage employer. So I'm not complaining, but on any income, 15 hours a week is not going to be generating a huge amount of income. And I'm privileged to be working. Many disabled people are not in a position where they can work at all. So it's really a huge burden on us to be in a position where there are massive costs involved. And the repair of my wheelchair cost $175. The company did begrudgingly supply the part, but I still had to get it fitted. So this is a cost of hundreds of dollars over a really short period of time, just directly because I am a disabled person who lives with a chronic illness. And I don't make of it what you will, but I think perhaps it gives some insight into the burden of cost, that disability tax that people talk about. But now we've had a chat about something really negative. Let's flip the script and talk about what DPA's been doing over the last month or so, a bit longer than that, to try and give you an insight into the work we do and the impact we make, and actually how phenomenal an organisation the DPA is. So the first thing that I want to talk about, and this was a real privilege for me, that I was invited to serve as a judge for accessibility at the Dunedin Fringe Festival. And gosh, it was fun. I got to go to a number of events and interact with the artists and really enjoy some really modern first-hand experiences of art, and art in all senses. Art in the sense of theatre, in the sense of visual art. I really had a great time. So the Accessibility Award at the Fringe Festival is sponsored by Julie Woods, who you might know as That Blind Woman. And it was really inspiring to me to see the creativity and growing awareness of accessibility within our arts community. So one of the exhibits I went to was called The Language of Wearing, and it offered a tactile experience of clothing items. And the point of their exhibit was to show the different materials and how that gives you a tactile experience. And the staff were really welcoming, and having such welcoming staff really made a difference, I expect, for blind and low vision visitors. We did have some ups and downs and recommendations because their wayfinding wasn't great, and the clothing were on wheelchair inaccessible shelves, but nonetheless, it was an incredibly enjoyable experience. I also went to the Goon Show, which was offered by some very young performers who brought humour and energy with a touch to at the beginning, which really helped the audience connect with some of the props used in this rather unusual performance. And a real standout for me of the events that I went to was called 40 Ways of Seeing for Wellbeing, which was an exhibit that was held by our Arts Centre, which caters for disabled people, those with mental illness primarily, and to enjoy the arts sector. And it really celebrated disabled artists. This particular exhibit received a commendation for accessibility in the Accessibility Awards. The award-winning show was called Lady Luck, and while I didn't get the opportunity to go to this show, it did demonstrate thoughtful, integrated accessibility and embedded a touch into the performance itself. And apparently this was absolutely phenomenal. So congratulations to the performer of Lady Luck. While there is clear progress and improvement is still needed, particularly in areas of access, one of the things is we really need meaningful use of New Zealand Sign Language interpreters rather than tokenistic use of NZSL. And that's just a suggestion. You can read more about this in our upcoming newsletter. Now, I want to talk a bit about transport. Transport is a key issue for the disabled community at the moment. The Total Mobility Scheme has been under review, and it's very clear that the government's going to make some significant cuts in the funding available for total mobility users. We also are in the middle of a fuel crisis, and while the cost of petrol anyway has dropped a little bit over the last couple of weeks, we're still looking in the $3.20 range for a litre of petrol. So our recent DPA transport workshop brought together community members and Otago Regional Council staff to have an honest conversation about transport for disabled people. We heard about real challenges. One of those things is limited taxi availability, another is high costs, and gaps in public transport availability. For some, accessing essential services is becoming unaffordable, and this is something that we need to address forthright. The ORC provided updates on the Total Mobility Scheme, B-cards, and upcoming changes, including these government-mandated cuts. While some improvements are underway, affordability remains a major concern. So one of the things that as DPA would like to see is more access for disabled people onto the bus network. Our buses in Dunedin, from a cost point of view, are really doing quite well. The cost to actually take a bus if you have a B card is relatively low. So if we can actually make our bus net more accessible to people with disabilities, that would really have an impact on people's access to transport and costs. Participants raised issues about things like narrow bus ramps, lack of driver assistance, some driver training issues. They said that early departures was an issue, and definitely lack of seating at bus stops was an issue. We were also privileged to be given the opportunity to have one of the new electric buses on site for our transport workshop, and this allowed hands-on feedback, but it also allowed to highlight some of the concerns around safety and accessibility designs. One of the things that many people who were at our transport who we pointed out was that there was no, for wheelchair users, there was no way of securing your wheelchair to the bus floor, which is a lacking accessibility feature and something that the OOC are definitely going to raise going forward. A key message is that progress is happening in trying to get our bus network particularly more accessible to the disabled community, but we need to work directly with the ORC, so this needs to be a sort of co-support program to actually move us forward in terms of using disabled people's lived experiences to inform accessibility decisions. So we have some surveys coming up for our participants where we're going to gather some really useful data that the ORC will be able to use to inform some of their decisions going forward with our transport network. And then I would like to talk about community-led responses. One of the things that we've done recently, and we had Belle on the show a couple of weeks ago, talking about Kia Haumaru's self-defence. So over the Anzac weekend, DPA and Kia Haumaru delivered the self-defence course for disabled people at the Blind and Low Vision Hall in South Dunedin. This course responded to a critical need because disabled women face higher rates of violence and often can't access traditional self-defence training. Participants at this course learned practical skills alongside communication strategies, awareness, and confidence building. The course was intentionally flexible and inclusive to allow women with a range of impairments to participate in a way that worked for them. Feedback from the course was overwhelmingly positive, with some participants reporting increased confidence and a greater sense of safety. And I would like to give a huge shout out to DPA member Tegan Howard for her volunteer support at this self-defense course. Without Tegan, I don't know how I would have physically managed to do all the bits and pieces, the prep work that needs to be done around running a workshop like this. So Tegan was on the ground making sure all the food was set up. Because of the security system at the blind and low vision hall, we needed somebody to be constantly checking the doors for participants coming in. Tegan did that. And Tegan did all this without a moment's hesitation or even instructions from me. She just went and did it, and she was a phenomenal support for me on the day. So thank you, Tegan. So next, we're going to talk a bit about lived experience. Her lived experience is central to the work that we do at Disabled Persons Assembly. And in order to understand lived experience, we need to talk to members of the community. And that was what my recent visit to the Ross home was all about. So I recently visited Ross home, which is a residential home in North Dunedin, which primarily caters for older people. We had a room full of residents who were sharing their lived experience. We heard about challenges from people who are hard of hearing, including lack of staff training, even when hearing aid signage is presented. So you will have seen in various retail establishments little yellow signs on the counter saying that if you have a hearing loss that you need to ask for assistance. Well, the reports from this particular group of community members was that even when they did ask for assistance and they pointed to this particular signage, the staff at these retail establishments did not have any training on how to speak with and communicate with people with significant hearing loss. So that is something that I'm definitely going to move forward with trying to address. Mobility barriers were also highlighted. One of the things that people talked about a lot was uneven pathways and poor curb access. One of the lovely ladies at this event talked about feeling incredibly uncomfortable on her mobility scooter due to the uneven pathways. So we really need to have a look with the council about our footpaths, not only in the central George Street area, which has, to their credit, been made phenomenally accessible by the recent Totally Gorgeous project, so that our disabled community members can access their community in the wider Dunedin suburbs. There was mixed feedback on public transport. Some members of this community had a lot of praise for the bus drivers on their route, and others had some concerns, and many of these concerns were similar to those highlighted at the transport workshop. And moving forward with the ORC and working with our relationship with Laura Faulkner from the ORC, we're going to try and address some of these issues for our community. It was such a valuable discussion, and I really look forward to returning to Ross Home with updates on the progress on the work that we've made based on their community feedback, and to hear any other further concerns that this community has. And thank you very much to Ross Home for inviting me and giving me this opportunity to talk to your residents. So one of the other challenges, everybody on the planet, but disabled people particularly are facing is climate change. And climate change is an area where disabled voices need to be heard because our responses to climate change need to be accessible and sympathetic to the needs of the disabled community. So DPA members were invited to attend a presentation on the South Dunedin Disability and Climate Action Project. So this is a very exciting project. It's one of the researchers is a DPA member, Anya. Oh gosh, what is Anya's surname? Costello-Kelly. Anya's Costello-Kelly, who is a disability researcher and member of our disabled community. She's blind, and she has really helped shape this research into being really sympathetic to the needs of the disabled community and very accessible research. So well done, Anya, for your work on that. It was actually... I was really, taken aback in a positive way by how the researchers, especially even at this event, had made so many accommodations to make sure that disabled people could participate. So the research highlighted a strong desire from disabled people to be involved in decision-making about their community. It also identified key barriers, financial challenges, and lack of accessible information, as well as inaccessible evacuation points. The project offers practical recommendations, including better communication by things like using accessible formatted, targeted support for some disabled people, and improved emergency planning for the disabled community. As climate risks increase, it's vital that disabled people are not an afterthought, but they are a part of the solution. We need to use, again, the lived experience of disabled people to inform our climate change adaptation. So, also, we've been rather busy here at DPA Notable Radio. So over the last year, we've been exploring a range of topics. We've discussed sensory access with Josh Slime recently, policy advocacy with Chris, and the impact of the 96 submissions that DPA made over the last year, the role of inclusive language with Patty Poa from DPA, the importance of learning our official languages, Te Reo Māori and New Zealand Sign Language. We looked at emerging issues, AI and its benefits and risks, and the importance of disabled voices in shaping technology. So all these conversations that we've had on DPA Notable Radio over the last few months reinforce one thing. Accessibility is not a favour for disabled people. It is our human right. And we actually need to really be pushing for that. So the last segment that I'm going to cover here on the show today is wider DPA work. So here is a quick update from DPA's latest newsletter, the Information Exchange, focusing on what is relevant to our community here in Ōtepoti Dunedin and across Aotearoa. New Zealand Sign Language is taking New Zealand Sign Language is taking place all the time, Amy. No, what I meant to say was New Zealand Sign Language Week is taking place this week from the 4th of May to the 10th of May. This year marks 20 years since New Zealand Sign Language first became an official language. And the theme of this year's New Zealand Sign Language Week is an Aotearoa where anyone can sign. Events are happening nationwide, and I was really privileged the other day to attend to an event at Toitu, hosted by the Mosgiel Abilities Centre, and I really enjoyed actually seeing the participants and their New Zealand Sign Language coming along so nicely. The Office of the Ombudsman is seeking applications for its Disability Advisory Panel. This is a great opportunity for people with lived experience to influence how government agencies uphold disability rights. Applications close on the 11th of May. Recent data highlighted by Whaikaha, the Ministry of Disabled People, shows that more than 1 in 4 disabled children in Aotearoa are living in poverty. This reinforces the need for policies that recognise the real cost of disability. As we have already discussed in the show, disability comes with massively inflated costs. A new social cohesion report also points to the growing disconnection across the country, with disabled people more likely to experience isolation and financial pressures. On this more positive note, accessibility work continues nationwide, with practical improvements being made to public spaces with initiatives like Barrier Free New Zealand. And Barrier Free New Zealand shows how small changes can make a big difference. Please visit DPA's website for further more information on the work that we have been doing over the last year. So as we move into winter, we accept the challenges for the disabled community are very real, but we also have real strength in our community. And through advocacy, collaboration and sharing lived experience, we continue to push forward for a more inclusive Aotearoa and locally Ōtepoti. You've been listening to DPA's Notable Radio. I'm your host, Amy Taylor. Thank you for joining us today.
Disabled Persons Assembly is Aotearoa, New Zealand's first pan-disability national organisation, providing system-level advocacy for all disabled people. Membership is free for individuals. If you'd like to know more, visit our national website at www.dpa.org.nz or contact your local kaituitui or community connector, Amy Taylor, at kaituitui.otipoti@dpa.org.nz. Disabled Persons Assembly, a whole new attitude.
This podcast was produced by OAR FM Dunedin with support from New Zealand On the Air.